come from another conference in cardiology now, and we all are talking about personalized medicine everywhere. So I am very happy to introduce you with this personalized dietary and lifestyle intervention for obesity.
Thank you so much.
Big welcome to you in Egypt.
Thank you so much, and once again, thanks to organizing committee and Professor Inos for inviting me. And today I will share with you this lecture about the personalized dietary intervention for lifestyle for treatment of obesity. So the obesity is really very present worldwide, and this is shortly saying what is the burden of obesity in the world. So worldwide obesity has nearly tripled since 1975. In 2016, more than 1.9 billion adults, so 18 years and older, were overweight, and of these, over 650 million were obese. What is even more important, 39 million children under the age of 5 were overweight or obese in 2020. So this is a huge problem, because the majority of these kids will be even more obese in their further life. So most of the world population what is living with obesity is coming from the countries where the overweight and obesity kill even more people than underweight. So I'm showing this very interesting global, regional, and national risk comparative risk assessment. And this risk assessment is assess 79 behavioral, environmental, occupational, and metabolic risk or clusters of risk in 188 countries from 1990 to 2013. And the conclusions of this risk assessment was that the unhealthy diet was the most important contributor to the global burden of many different diseases, mainly cardiovascular and, as we very well know, diabetes. So that's why we all know that the prevention or the lifestyle weight management is very important, like a first step in treatment or approach to people who are living with obesity. Why it is important? Because in people with type 2 diabetes can improve their metabolic control, and different cardiovascular risk factors also can improve the quality of life, and even more important, it can increase the life expectancy. So of course, when the people are losing weight, the burden of different obesity is lower, and that's why the life expectancy is longer. What are the main components of these therapeutic lifestyle changes? As you very well know, this is the nutrition, then physical activity, and also what is the main important thing? We are asking of almost adult people to lose weight or to start with physical activity, with one word, to change their behavior, which is quite difficult even in the earlier age, very difficult in adult people. And that's why it is very important behavioral approach to these people, or to help them with support how to lose weight and to change some of their habits. So what is the first about nutrition? So there are a couple of evaluation of different approaches to personalized dietary recommendations for weight loss. So there is some evidence for genotype approach, then enterotype and metabotype, but until now we do not have enough evidence that we can recommend all of these approaches to be in clinical use or to support our people with the general recommendation. What we know so far is that recommendations about nutrition are very important, and they actually can help patients to lose weight. And for that, of course, we need approach from before trained nutritionists or advisors who can advise special diets or individual diet for every person who is living with obesity. And of course, it is very well known that the first approach is to recommend to those patients with obesity to reduce their daily calorie intake, or to choose some meal plan how to lose weight. And of course, it must be a negative energy balance, what is necessary not just to lose weight, but also to maintain the weight that they were able to lose with some type of diet. But even more important, the type of diet is an adherence to that diet or to that meal plan. So it is more important not just for losing weight, but for maintaining the weight that they were able to lose. So this is very interesting study that shows what is the effect of 4 different diets: Atkins, Zone, Weight Watchers, and Ornish diet, in different people, how they can lose weight with these 4 diets. And as we can see, all 4 diets are quite effective in losing weight. So they can lose weight with this type of diet. But what is noticed that the people who had a better adherence to the diet, those group of people were able to reach the target or to lose approximately at least 7% of initial body weight. So not just the diet, but to find a way how to make people to be adherent to this type of eating, or to find something that is quite similar to their habits and cultural and any other preference that they had before. So I will show you what is the effects of the most recommended type of diet in literature. So this is first what is the effect of low fat and low carb diet on weight reduction. So as you can see, this is one study when it was studied 307 adult person with obesity, and the both diet were quite effective in terms of losing weight. So the patients were able to lose around 11 kilos after 12 months, and about 7 kilos at the end of the trial after 2 years. So regarding the weight loss, the diet were comparable. But what was the effect on the diets on lipid profile and other cardiometabolic risk factors? So it was shown that the low carb diet, the people had beneficial effect on reducing the blood pressure, but also reducing the triglyceride level, VLDL level, modestly LDL level, and also they were able to increase the HDL cholesterol. So the low carb diet was quite efficient, not just for weight loss, but also for improving some cardiovascular risk factors. It is another study, so-called direct study. It was dietary intervention randomized control trial. There was included 322 overweight or obese adults, mainly men, and they were followed up for a 2 years period of time, and they were randomly assigned to low fat, Mediterranean, or low carb diet. Regarding the recommendation in first 2 group, low fat and Mediterranean, there was a calorie restriction, 1,500 for women and 1,800 for men. And in low carb diet, there was no restriction, only restriction was of amount of carbs that they were taking. So the amount of carb was really low, 20 grams per day for the first 2 months, and then 120 grams per day for the rest of the duration of the trial. So what was the results of the trial after the two years? We can see that regarding the body weight, the most efficient were Mediterranean and low carb diet in comparison to low fat diet. But as you can see at that part of the slide, the adherence to low carb diet was not so good because it was quite hard for people to follow that low level of carb that it was recommended. But still, what was the main results is that the both diet, low carb and Mediterranean diet, was the more efficient in reduction of body weight in comparison to low fat diet. And even after 6 years of following these patients, those who were on Mediterranean diet, they were able to maintain 3 kilos weight loss in the comparison with the start weight loss. So this is one good example that Mediterranean diet is very efficient regarding losing body weight, but also it is good for some cardiometabolic risk factors. What was the effect on other parameters? As we saw at the previous trials, also in this trial, Mediterranean diet was the most effective regarding the improving on fasting plasma blood glucose, but the low carb diet was efficient in reducing the lipid profile, which was also beneficial for this patient because it was reduction of cardiovascular risk factors. Also, we know very, very much about the Mediterranean diet, and we can discuss later on if you want to. We know the Predimed trial that was made in Europe, in Spain. It was so effective, not just in losing body weight, but also in cardiovascular prevention. But this was one meta-analysis that was done in USA, and this trial also shows that Mediterranean diet was very efficient in patients in USA, not just in improving overall mortality, but also to improving mortality of some types of cancer, which are so characteristic for patients with obesity. Regarding the physical activity, we spoke something about that this morning, but this is the different aspect. We know that for the physical activity must be combined with nutritional therapy for weight management. But if we combine a physical activity like 150 minutes per week together with dietary approach, that can add 1 to 3% more weight loss if it is only a diet. So the recommendations are, if even the patient wants to maintain or to improve the reduction of body weight, it must be even more vigorous physical activity than it is recommended. Regarding how much physical activity is enough, there is a lot of trials that are suggest, one of this that I am showing, that it is enough 150 minutes per week or 175 minutes, what it was in Look Ahead trial. So this time of activity per week, if enough, together with dietary approach to help people to reduce their body weight. Also, this is very nice trial in a sedentary made in sedentary women, and they were randomly assigned to different intensity and different time of physical activity, and as we can see, there was a significant loss of body weight in both groups, no matter what was the intensity or duration. It was important that some kind of physical activity can help the patients to lose weight. And finally, behavioral intervention. For me, this is one of the most important things in all this story. We must start in people who are living with obesity with this behavioral approach to help them to start even to think how to reduce their body weight. So the support can be individual support or maybe a group support, but they need support all the time. And the effect is better when the people are receiving support during their losing weight. So this is a very clear way to show you that what is the important for losing or for body weight reduction. It is the most important behavioral treatment, individual or structured group education, either in person or telephone or some other way, but they need support. Then ongoing following up of this person, hypocaloric nutrition and exercise. And all these parts can be so efficient to help people to lose weight. Also, 2 trials are showing us how important is this behavioral approach for people with diabetes, also with obesity, to lose weight. This is in DPP trial. The people were on continuous supervision by their physicians, and with each kilos that they were able to lose, they were able to reduce 16% their risk for developing of type 2 diabetes. Also in look ahead trials, it's a very good example when we can see that the weight loss was the most prominent the first year when the patients were very closely followed, and after that with continuous following up the body weight, they were able to maintain the body weight that they lose at the first year. So also at this trial you can see what is the benefit of ongoing behavioral support to people with obesity to lose weight. So you can see that even this support is in person or via telephone or via different kind of contact with patients, they were able to lose significantly more weight in comparison to those who are losing weight without any support or advice from their healthcare physicians. Also, this is very important trial, maybe the last that I will show you. This is the Jenny Craig trial. It is made in USA trial, and here you can see that the patients were divided into 3 groups. The first in blue, that was column where the patient have in-person consultation with healthcare providers. The second in green, it was via telephone. And the third, this gray column, is the group without support with usual care. And you can see that the support of these people, no matter on what way it will be done, it is more effective for them and it helps them to lose more weight than without any support. So in summary, I can say that the lifestyle intervention, they can very effectively prevent physical and metabolic complication of obesity. The weight loss with lifestyle changes is very difficult, not just to achieve, but even more to maintain that loss in body weight, and that's why the patients need behavioral support all the time. And that's why not just simple advices, but there must be a support group that made of healthcare professionals or whole team who can help the patients not just to lose weight but also to maintain that body weight reduction. So thank you for your attention.